So for this assignment, we were required to watch the TED Talk titled "What Will Healthcare Look Like in the Year 2020" by Stephen Klasko. The video was published in November of 2014, and it was set 10 years in the future in the year 2024. It talked about the new advances in healthcare that we would have in 2024. One of these was future admissions would be transformed for physicians, and that there would be more emotionally intelligent physicians in the future. I can see how this would be helpful in some areas and not so helpful in others. They talked about no longer using scores for jobs, and I don't think that would be the most efficient way to screen for doctors, as they do need to have high test scores, and they do need to have appropriate knowledge and know what they're doing. Though I can see how having more emotionally intelligent and physicians can be helpful. My grandpa passed away from cancer in 2016, and we ran into a few instances where the healthcare providers were just inconsiderate in some manners. When you have someone coming in and they make the comment, "Oh, he's not dead yet," that's inappropriate. You don't want to hear that from your healthcare provider. They're supposed to be there to provide assistance, and part of that, when dealing with a cancer patient who's terminally ill, should include some emotional support in some manner. So that would have been helpful. Other changes that were predicted to occur by 2024 were doctors embracing change instead of trying to fight it. Changing the way they teach physicians, such as instead of using large lectures in auditoriums, teaching them through art, having them interpret the art to better understand their patients. Using workshops, changing the way they treat individuals, helping doctors become part of the team instead of captain of the ship, so to say, and improving patient experience. All of these sound like potentially productive ideas if potentially implemented. Of course, I do feel that it should remain the goal, or not the goal, it should remain the focus of the doctor to administer the services that they're trained and went to school to do, maybe while at the same time being a little more caring while they do it, and not appearing to be so inconsiderate or not caring about your particular situation while they're treating you. Another thing that was to be improved upon was, or implemented, was entrepreneurship being embraced. Being able to access doctors via telephone or video chat. Using math and modeling to help treat patients, and having their treatments being specific to their DNA and genome, having DNA vending machines, having your genome map on a chip and being able to use that to create new organs. Another thing was having patients better understanding their bills and the information they're receiving, and one of the last things was doctors being rated based off of patient experience. So how close are we to these predictions? Some of them we've already obtained. We can talk to our doctors via video chat. You can't talk to them for everything. Some things you physically need to go into the doctor for, to have your blood drawn, or do specific tests to see if you maybe have strep throat or if you have the flu. Some of those things you need to go to the doctor's office for. But maybe a sinus infection, or maybe just a really bad cold, or things like that. It's helpful to have being able to talk to the doctor on the phone. That is helpful. As far as having DNA vending machines, this seems to be very far into the future. This does not seem to be something that we will have in the next few years. So some of the predictions are on point and on track, and some of them seem far away. As far as having more emotionally intelligent physicians, I don't know if this is a step that we will make. And the current administration's role in healthcare, right now they do seem to be trying to make progress and have better healthcare for the United States. They also seem to be meeting a lot of opposition politically. So I don't know, they don't seem to be making much progress, though they do seem to be trying. So it's interesting to see where this will take us and how close we will be to this by 2024, or where we will be in general in 2024.